Bob Bennett of Utah. Senator, thank you for taking time out from this debate today.
Happy to do it.
All right, let me ask you about the different negotiations going on with the Democrats. We understand there is a group of 10 put together by the majority leader to hammer out some compromise, possibly on a government run or public option. We know that another group is going to meet with President Obama. Are Republicans feeling excluded today?
Oh, we've been excluded all along. The bill was put together in Harry Reid's office by Democrats. There was not a single Republican in the room when it was done. We found out about it the same time you did when he announced it on the press. There's no effort whatsoever to have any Republican input on this bill, and frankly, I think that's probably wise because the bill is beyond fixing. It's terrible, and most of the Democrats that I talk to privately agree it's terrible, but they're determined they want to give the president a victory even at the rate of passing a terrible bill.
And there is a lot of public optimism among Democrats talking about having those 60 votes and making the changes they need to make to the bill to get those 60 votes. Do you have any question they'll be able to get there?
Oh, you never can tell. They'll be making deals, they'll be making promises, as they did to get the 60 votes to get on the bill in the first place. Harry had a hard time even getting the bill up for consideration, and he had to make a lot of promises to a lot of people. I really don't know how they'll be able to work it out. But the longer this thing stays around, the worse the polls become. The American people, the more they find out about this bill, the less they like it, and particularly the less they like it in states where there are some vulnerable Democrats up for election in 2010. So that's a large part of the reason why they're pushing to get it done as fast as possible.
And we do hear a growing number of your colleagues talk about the fact that this is something that seems to be unpopular when you look at a lot of the polling and what they're hearing from back home. Where do you think there's a disconnect between those who want to push this particular bill through and the American people who, many of them seem to say they don't want it?
Well, this represents the largest increase in governmental intrusion into our lives since probably the Franklin Roosevelt days and the New Deal. And that's the kind of agenda many Democrats want. They're less concerned about the details of the bill than they are about the amount of government power that would come with it. And so they say, look, hold your nose, close your eyes, grit your teeth, whatever it takes, but vote for this. Even if it costs us, I think Nancy Pelosi said she's willing to sacrifice 30 seats if necessary in the House in order to get this done. Well, the polls I've seen, she may sacrifice her speakership to get it done because the anger over this bill is that strong.
Let me ask you about the issue of abortion, which has gotten a lot of attention. Obviously, the Stupak Amendment on the House side bans federal funding going toward abortion. Similar measure bubbling up there in the Senate side. May get to it tomorrow. How do you see that playing out?
Well, Senator Nelson of Nebraska has said he's very, very hard on this one. If something like the Stupak Amendment can't get put in, and a hard version of it, he will join the Republicans and kill the bill. So we'll see. That negotiation has to go forward.
Is that a make or break issue for you personally?
As I say, there are so many things wrong with this bill that that's just one of the things. I couldn't vote for this mess regardless of what kind of changes they made to it. The thing we need to do is focus on the problem rather than the politics. This bill is drawn entirely with a political solution, reaching out to various political groups in the Democratic coalition, and it will not solve the health care problem. It will make it worse, and that's why I couldn't vote for it, even if you were to say, oh, we solved this problem and we solved that. The whole bill is unrescuable, if that's a word.
All right, Senator, we certainly know where you stand. We know you're busy. Thanks for taking a break from the work. We'll be watching. Senator, thank you.
Thank you.
Well, one of the key architects of the Democrats' health care plan, Senator Max Baucus, is defending himself now against accusations